Nearly 500,000 people committed suicide in the last 10 years, and it has been an increasing trend. Pandemic gave us somewhat of a break, but the suicide rate is rising again. What's happening in America? What can be done about it? We have a scholar in this field, Dr. Rania Awad. Welcome to Muslim Network TV and Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. It's a pleasure to be here.
Dr. Dr. Rania Awad is a clinical associate professor of psychiatry at the Stanford University School of Medicine. She also is director of Stanford Muslim Mental Health. Please share with us why so many suicides in our country.
It's a great question, Imam Mujahid. I think this is something we really have to reflect on. Nationally, as a country, we know that currently we have still not fully emerged from a global pandemic. Certainly, the rates have gone up in terms of suicide attempts and both suicide deaths in the last couple of years. And this also has not been, our Muslim communities haven't been immune to this either. A lot of this does have to do with the changes that have happened in the pandemic, but also two major causes, one of which relates to feeling a sense of burdensomeness, whether that's on our families or in our communities or our society, or feeling a lack of belonging. Again, whether it's at the family level, the community level, or in the societal level. When people have these aspects in combination with other things that may be happening biologically or genetically, like mental health conditions, or perhaps environmentally or socially or spiritually, this does increase the rates of suicide attempts and deaths by suicide.
But the rate of suicide is going up for 14 years. A little bit of break came during the pandemic. So pandemic, while it was such a traumatic thing, which is still is ongoing, why suicide became lower during that period? Was it because families were together? Was it because people were working with each other better? What were the rate for lowering? Because there might be some insight in how to handle suicide.
Of course. I think it's important to also look at what the trends are. There's a lot of still emerging research on this topic. So I can't say that we conclusively know. When we look at the Muslim community, for example, and the rates there of how exactly the how people were dealing with COVID-19 and the pandemic, what we saw was some really interesting research, actually. There was a study my lab did in correlation with the Yaqeen Institute, a very large global study on COVID-19 pandemic and Muslims. And what was very interesting there is that we found that when people turn to spirituality, they turn to their religion, they turn to aspects of the unknown, because the pandemic, there were so many unknowns. And so when they turn to Allah subhanahu wa ta'ala, in that He was the one who is the holder of the unknown, they actually fared better. Their mental health actually did better. And when the opposite is also true, when they did not do so and there was a lot more worrying, we found that people actually had a higher chance of developing MDD or major depressive disorder by at least 70%.
Now, the minorities in the United States, especially Black and Native Americans, have a higher rates of death by suicide. Are there specific variables for that?
Certainly, whenever there's marginalized or minority communities, there are many more complicating factors that are added to the picture. And so, whereas access to care and resources to care and prevention upstream, we talk about upstream prevention of suicide and downstream work as well. Many of those resources are not in place for marginalized communities, and the communities are even more affected. Like the example of COVID-19 pandemic, the deaths from the pandemic and also the loss of jobs and stability economically and with resources was even more prominent in those marginalized communities. So yes, there is many more complicating factors there.
So more death during the COVID for minorities and more death by suicide for the minorities, it seems.
Correct.
Now, Muslims, are they typical of the other minorities, or there are different variables which apply to Muslim community?
Here too, there are varying variables as well, because as we know with the Muslim community, if we look at the American Muslim communities, we find that there are actually multiple communities. It's not just one community. So the racial, ethnic backgrounds, social economic backgrounds absolutely play a factor here too. So it's not just one reality for all American Muslims. It really does depend by community. Well, the one unifying factor is their faith and their religion. And so sometimes it is easier to actually compare across faith groups than across social, economic, and racial ethnic backgrounds, because here you're going to find many various variables.
So, the study which you have done of Muslims globally, how many people participated in that, or was it scientifically reliable?
The study that you're referring to relates to a study that was actually conducted by the ISP, the Institute of Social Policy and Understanding. It is part of their American Muslim poll that they do annually. The data that we published so far has been in the 2019, so pre-pandemic data. And it was a comparative study across different faith and ethnic groups across all of the US. And so this was a robust study in which we were able to add specific questions related to mental health, one of which was related to suicide.
Now, federal government seems to be paying attention to that. They have mandated a three-digit crisis number 988
Correct.
for help. Do you think someone who is committed to commit suicide or thinking about suicide will call that number? Are these, I mean, there have been many crisis lines and phone lines and text lines. We also have one text salam to 741 741. But do you think these things are helpful, or we're doing our job whether somebody benefits from it or not?
Here too, there are many important aspects to consider. I think that we are going into the right direction of having 988. It's a shortened number from what used to be the 188 number. It was much longer national suicide hotline number. Now it's a quick number. It's easy to remember, and it's different than 911. Often we are very concerned about law enforcement getting involved in cases like this. We prefer people who are trained in mental health professionally. And so when you call the 988 number, what happens is you're directly routed 24 hours a day, 7 days a week, directly routed to somebody who can assist and screen and be able to tell that person if they need immediately to go into emergency care or even send them emergency services, versus which, the number was maybe harder to remember before. So we have actually seen, since the government rolled this out in July of this year, 2022, a 45% jump increase in people actually using the hotline. In terms of how effective it will be in the long term, this is yet to be seen. It's only been in place only a few months. And I should also add here that there is an effort for our Muslim communities. We are currently working on a public service announcement, a PSA, with imams across the nation and sheikhat across the nation to actually encourage the Muslim communities to use the 988 number in hopes that this will help bring down the very high number of increase we're seeing within Muslim communities of suicide attempts.
I have seen recently, talking about the Muslim community and Friday sermons, there is a high level of emphasis on seeking professional help. Of course, this is probably motivated by the fact that people have not been doing that. But when they emphasize the need for seeking professional help, it seems inadvertently or intentionally they de emphasize the spiritual aspect of help. While you're saying that your survey determined that spirituality was important in helping people out of the crisis mode.
I think it's very important that we do not lose sight of either. I think that is our worldview as Muslims is one that is very much integrated. We have no issue with religion and science together. They are together, and very much spirituality as well as professional medical care is going to be very important here. I would argue and say that just as the khutbahs remind us spiritually and aspects of spirituality lift us up and help us as a Muslim community, the same has to happen with understanding that it's not limited to just one sphere of wellness. Also, our wellness is considered to be biological, physical, mental, emotional. All of these aspects have to be up, those voices have to be uplifted in our khutbahs in our communities. And so I think it's actually in the right direction, that we're talking about all these integrated parts of our wellness.
Well, Professor Rania Awaad, thank you so much for your time and for being with us once again. Thank you
Of
so
course.
much.
My pleasure. Thank you.